Where do prices stand? How much do you have in terms of the ability to raise prices?
So by principle, do not want to be the most expensive in the market, no matter how high our facilities are. We want to make it as reasonable as possible, keeping in mind that as many people who can access this kind of treatment should benefit. It should not be for the elite. So if you look at our mix, we have all people, the highest people you can talk about in your hierarchy. I don't consider them high or low, but I'm saying that at all economic strata, all educational strata, government, all that stuff, we are agnostic. We want to give the same treatment to everybody because human life is the same, no matter where you come from. So we try to keep it as affordable, keeping in mind that you need a certain margin to be able to, renew yourself, which is very important because technology is the backbone, and technology gets obsolete within 7 years. This whole 25 crore machines, the company says end of life. I mean, these are bizarre things that have happened, but we are in the clutches of international manufacturers. Of course, with this Atmanirbhar, things are improving. We will, in times to come, produce our own MRIs and high-end scans and stuff like that, which we don't today. So we are totally dependent on these companies from around, and they can dictate. They said after 10 years, although the machine can be extended to longer, much longer, maybe 15 years, 20 years, some of the machines, but they refuse to give parts. They say, well, now we don't manufacture parts anymore. So you have no choice. So I'm saying that you have to keep it in mind that the pricing has to give enough that you can renew yourself, you can pay back your debts, and also leave enough margin for growth. So putting this together, I think that around 20 to 25% is the ideal margin which you should have in healthcare, because it's like I always say, it's not a business, it's a business with a soul. It's not cold-blooded in any way, it should never be. So for us, medicine first, because I have said it many times, that good medicine will give you good returns, but good business will not give you. So that's the whole.
So will the margins probably sustain at 20%? You've done 20% in the previous quarter.
We're doing 22, 23%. No, I mean, if it goes up 2, 3, 4%, which is not bad, which is good. It only gives us enough elbow room to create more. But you don't want to cut corners. You never want to compromise the quality of treatment. You do not, and like I said, you don't want to deny people. Because, people who are already on the sidelines, okay, they deserve medicine as much as anybody does. So you try to make it possible in whatever way, how. Now you see, the government has also taken that view with Ayushman coming in. There is the relief, there's a safety net for 50 crore people. And now the government is also talking about increasing that net, and how it should be. People who can afford should buy private insurance. People who can't afford should be given this kind of safety net, which the government has done.
So has healthcare changed post-COVID-19 because there's more awareness? People are walking into the hospitals more simply because there is more insurance penetration which has taken place as well. And like you mentioned, there is some amount of catch-up in terms of infrastructure.
So,
Are we in a
psychologically, if you look at it, it became very clear to people that people who had comorbidities and got COVID, especially in the Delta wave, they were the ones who were really vulnerable to losing their life. The healthier ones, no matter what their age was, they were the ones who survived the best. So what does that do? It shakes you up to say, okay, one, I want to invest in health. The other, I want to invest in my protection. So that is why the more and more people will seek that. And so that's a very good thing to say, that if we have healthier India, I mean, we would be, no question, on top of the world. Because of the fact, simple fact, that we are more suited than any other country, like I told you before, to be able to offer these services. I believe, and this is my belief, you agree or don't agree, that God gave us the best brains in the world. Indians do have the best brains. But we don't have that discipline yet. If we can combine the two, why do Indians perform beyond anybody when they go overseas? Because they have the brains, they have the intelligence, we have the innovative spirit in, like we call Jugaad. We can do many of those things because this is survival in India. Now the next thing is that the environment there is so well organized that the systems are so robust that people function very nicely in there. Now that's Medanta, that we have created those protocols, those systems, because we don't have visiting doctors. We have full-time doctors. Everybody is here. They've staked their profession, their life, everything in one place. So that's the difference between having 1,000 visiting people who will fill up the beds, but then the standard will not be there and there is no sense of belonging. So if you have a sense of belonging, as you go forward, you will see more and more people will come into the loop and actually want to stay and stake their whole career here.
Dr. Trehan, you're now a listed company. So let me ask you, what might your 2 to 3 year vision be?
So look, we have reached, and that's why we did the IPO, we have reached a stage in the life of this company where it has been well recognized that the standard that we created, because when we first started this, the people wondered whether this kind of hospital will even work. But it speaks for itself, because from here we have created 5 other hospitals. Okay. So now we have reached a stage in our life where we can actually take the standards, which are now very robust. The protocols are all set, that we can do it much more, I'd say rapidly than we would have otherwise if we just did organic. So that way it gives you that flexibility, one, to serve more and more people, right? And also investors got their exit, which is also the second most important thing, that everybody should feel that we have recognized their participation and they can actually go on to the next, because that's what the financial institutions do. So that's the freedom to everybody. I didn't sell, we don't want to sell, we just want to keep.
Would you look to probably sell some stake later?
No, I have a belief that we've got a very good thing going. We should build on it. And I'm a doctor, so my satisfaction doesn't come from money. Truly.
It comes from quality of healthcare.
No, also our patients. You will not believe that your blessings, your success, everything comes from 3 simple facts. One, when a patient comes to you, he should have the confidence that you're going to give him the best treatment available in the world that he deserves, right? That you have the knowledge to do it and you will sincerely do it.
Preventive healthcare, that seems to be a big emerging segment. Is that the case?
Okay, so very good question, because we became doctors to treat disease. Then we said we are smarter than that. Why not early detection so they don't get so sick and their outcomes will be better? Then we said, why let people get sick? Then this whole wellness, preventive started, okay? But now we have gone beyond that. Now we are saying predictive health. Medanta is leading the way in that, by the way. That we are saying now there is enough knowledge, enough technology, enough algorithm that we can create today with the help of knowledge and technology to predict to a great degree on some of the diseases like heart disease, like diabetes, even some cancers. So when a person comes to you with, say, a family history of heart disease, now should he live in fear all his life? What are the things we write? Because from our wellness program, from our preventive, but we go beyond that. You can predict with their genetic makeup, their biomolecular makeup now, to say what are your chances. So you can be much more precise than you were before. Diabetes, you can prevent diabetes because we have the knowledge today to say, yes, these are the parameters you need to look at. This is the algorithm for an individual. So what you're saying is personalized medicine. And in that medicine, you can say, look, you have absolutely 25% chance of developing diabetes if you're not careful from today onwards. Now that person stays warned. If I tell the whole world, don't eat sugar, don't eat this, you may get diabetes, nobody's going to listen. And that's what's happening. You think that after all, we have gone blue in the face talking about what are the bad parts about fat, what about meats, what about this, what about that, junk food. You look at the success of junk food companies. It's going through the roof.
All right, Dr. Trehan, it's been a wonderful conversation. Thank you very much for joining
Thank you,
in
Ekta. Thank you.
and
Enjoyed it
taking
myself.
some time. Thank you.